Hi, my name is Katie Lindmark, and together with Jessica Bayard, we have put together a short video presentation on our International Health Project. We chose the topic of HIV prevention in Botswana because after sitting and doing some research, this was one country that just stood out to us as a place that could use our help. In 2011, there was an estimated 340,000 plus people in Botswana with HIV, and Botswana's total population is just barely over 2 million people. So that statistic means that approximately 1 in 4 people over the age of 15 most likely have HIV. And this is the second highest rate of HIV in the world. So very significant, very high numbers and scary statistics. And in 2012, the average life expectancy of somebody in Botswana was only 53 years old. And so those statistics just really stood out to me as something that was sad. I mean, living in the United States, we are just so blessed to have access to modern medicine and technology that I think sometimes we take it for granted. We don't even realize it. 53 years old seems young to us. So to think that that's the average life expectancy in Botswana was really scary and something that needed to change. So we wanted to figure out what it was about Botswana that was causing those numbers to be so high, and by doing so, figure out what we could do to make a difference. So after a little research, we came across a couple cultural traditions that could play somewhat of a role in these high numbers of HIV. One of their traditions is that they typically marry or have relationships intergenerationally. And so that is not a common practice we see in the US, but that is definitely a practice that is still seen in other parts of the world and can definitely put you at a higher risk for HIV. Also, it is not uncommon for men to have multiple partners and be with multiple women at the same time. And this can obviously be another high risk factor for contracting HIV. So we wanted to focus our intervention plan and prevention plan on some of these topics, and by doing so we wanted to be very careful in respecting those traditions, yet also educating them on the risk factors that they are put into by practicing these, I guess, and help find a balance and a way to help prevent this. So we thought that the best thing to do would be to first educate people. I think a lot of people in Botswana aren't even really aware of what HIV is. And if you're not aware of what the disease is, it's hard for you to treat it. So we definitely wanted to do a basic sex education class and just go over some of the sexually transmitted diseases, specifically focusing on HIV, and just teaching them about how this disease can cause, complete failure of your immune system, and how being diagnosed with HIV can lead to a lot of other risk and diseases such as AIDS, and helping them to figure out a way to either prevent or treat it if already diagnosed, as HIV is not something that you can get rid of once you're diagnosed. You will have it for life, and it is definitely a life-threatening disease, so we want to make sure that we can help prevent it or help it from progressing. So one method we came up with is showing pictures in education classes. We felt like pictures would be a great way to help better show the side effects of HIV. I think sometimes when you go to teach somebody, a topic that is new to them, sometimes big words and scientific terms can be very intimidating and hard to understand. But if you show pictures, I think people of all ages can relate to that better. So we definitely wanted to bring a lot of pictures, and then also just make sure that all of our resources and research that materials that we bring are worded appropriately for our audience so that they can better understand and relate to it, because we want to make sure that this education lasts a lifetime, that they are made aware of the dangers of HIV and the dangers of some of the cultural norms that they are used to, and help hopefully inspire them to want to educate others and pass this on for generations to come. Our ultimate goal is to see the number of people living with HIV in Botswana decrease dramatically, while also increasing the age that people survive. We want the life expectancy to increase dramatically. We want people to, we want to promote happy, healthy lifestyles, and we know that there will be some challenges that we will face, but we also know that this is a goal that is realistic, and it may take time, but that every little bit helps, and the sooner we can help to educate people out there, the sooner we can begin saving lives.
So with our project, we foresaw some potential barriers to our intervention plans that we had. Some of the barriers that we foresee as seeing issues are cultural issues. A lot of the current HIV prevention programs draw a lot of women and are really effective in educating the women, but the men generally don't see it as being a problem, and so they don't come. But most of the practices that need to change have to do with the men, and so that's a huge issue. Some other things that will also potentially be problems are people not understanding the seriousness of HIV or what exactly it actually causes. We'll have a lot of costs to pay for volunteers and the educational supplies that we'll need, as well as medical supplies and the doctors and nurses and other skilled healthcare professionals that we'll need to hire. It's going to be a challenge to get into the rural areas where this tends to be more of an issue, as well as being able to have our program approved through the government and them allowing us into those areas and being able to carry this out. One thing that also tends to be a problem, I think, with a lot of projects where volunteers come into a poor country or a poor area and volunteer provide services, are making lasting changes and then use those funds towards covering the costs of certain projects. And that way we can involve and employ more of the local community members and women. And those bracelets and necklaces can also be a way of raising HIV awareness in the United States and other areas, so we can sell them here. In order to implement our program, we'll need to have the government backing us as far as support and allowing us to come in, and so we need to teach them exactly, what our plan is, what we're planning on doing, and the benefits, how that will help their country, that it will lower their HIV rates as well as lower their infant and maternal mortality, because so many pregnant women are affected by HIV and their babies as well. And by that, overall, their communities and their country will become healthier in Botswana. Overall, I think we have to understand that change isn't going to happen overnight. And as much as we want everything to be fixed, it's going to take time. But anything that we can do to help the people that we can educate and the women and men that will change as their culture changes and as those communities change, eventually we will see the overall significant decrease in HIV that we see today. But it's going to take time, and it's going to take small changes and individuals doing their part. And in the meantime, we will do the very best that we can to continue to move forward and help preventing HIV and promoting change.